I'm glad that you mentioned the word emergency, because in preparing for our discussion today, it occurred to me that in this uh, list of roles that your title assumes, that scientific information on how to improve health comes first. Then you mentioned emergency. So what I'd like to talk about first is health, not lack of health,
Yeah.
but health. So often we hear about the mental health crisis, but what we're really talking about is the lack of mental health crisis, aka mental illness. And rarely do we hear, for instance, what constitutes mental health. We hear what constitutes mental illness. Whereas in the domain of physical health, there's a lot of information out there about how to be more physically healthy: cardiovascular exercise, resistance exercise, yoga type exercise, mobility, etc. And of course, some people have physical health ailments, and there's a lot of information in terms of how to deal with that as well. But what I would like to know before we get into the long list of issues that our nation confronts, everything from obesity to food additives to mental health issues, what is going well? In other words, in the last, let's say, 5 to 10 years, have there been any areas of physical health and mental health improvement in the U.S. at large that we can attribute to some of the public health initiatives directly?
So that's a really good question. And let me just also say about the very first point you raised, that you're absolutely right that we have operated primarily through an illness frame when we look at health. And in my mind, that's only one half of the equation, right? So when we are talking about physical illness, for example, as a doctor, I learned how to diagnose and treat someone with diabetes or with high blood pressure or with coronary heart disease. But we also know that even if I don't have diabetes or coronary heart disease or high blood pressure, even if I don't have any diagnosable medical condition, I may not be at an optimal level of physical health, right? I may not be able to, for example, walk around the block without getting short of breath. I may not be able to play with my kids because my physical fitness and stamina is insufficient. I may not be able to lift my luggage when I go to the airport because I don't have enough strength in my body. Yet I wouldn't have a diagnosable mental illness. So I think it's easier to understand there with physical health that we're not just aiming for lack of illness, we're aiming to optimize our physical health. The same is true with mental health. And I think when we talk about mental health, people think the sole goal here is to prevent diagnosable mental illness. That is one goal, to both prevent and to manage mental illness when it arises. But we also need to recognize there's a whole other half of the spectrum where there are people who may not have diagnosable mental illness, but are not operating optimally in their lives, and that's detracting from their fulfillment, from their functionality, like in not just at work, but also in their communities and in their families. And so I think part of the conversation that I want us to have as a country is about how to optimize mental health and well-being, and that includes preventing mental illness, but it is much broader and bigger than that alone.
Great. Yeah, I think it's so important that we recognize that treating disease is critical, obviously, but that there's a lot that can be done to improve one's health, even in the absence of any known disease. And you've got all these officers, these incredible physicians and nurses and people at your disposal. My hope is that they would also be accessible for and currently carrying out efforts to transmit information to people about, hey, here are the things that you can do every day, every week, every month in order to make your life as healthy as possible, as well as, rushing in under conditions of, public health crisis.
Yeah, it's a good point. And it's certainly, many of our officers do focus on this broader rubric around well-being. But it's part of how we need, I think, the broader health system and public health system to operate even outside of government. And this, I think, will require significant change and shift in how we think about our jobs. Like when I went to medical school, the vast majority of the focus was on diagnosing and treating illness. It was much, much less focused on thinking about how to enhance well-being. And when you ask and talk to people in their lives, it becomes clear that they want to do more than just prevent diagnosable illness. They want to be able to walk their child down the aisle. They want and have the endurance to do that. They want to be able to be independent often and carry their groceries or carry their luggage. This is why I think we've got to broaden our focus in public health. And look, when I came into this role, by the way, I was not expecting to serve in government. This was not part of some 5, 10, 30-year plan. When I was a kid, I was interested in medicine, but I always thought I was going to practice medicine, like my dad did, and like the clinic my mom ran. Put up a shingle, see patients, and be a primary care doctor, and feel good about the work I was doing. But what happened to me along the way is, I trained in medicine. I got interested in technology. Spent 7 years building a technology company that was focused on health. I became increasingly worried about the way we were delivering healthcare. I felt like our healthcare system was broken. People who needed care couldn't get it. It was often too expensive to get care. We were focusing on treatment solely and not enough on prevention. So I started getting involved in advocating for a better healthcare system with doctors around the country. When despite all that, I still never thought I would work in government. But in 2013 is when President Obama's team had reached out to me and asked if I'd be interested in considering the position of Surgeon General. And what was interesting to me about this position is it's actually very different from most positions that are appointed by a president in government, in that it's supposed to be an independent position. So my agenda, the issues I choose to take on, are not determined by a president or a party. They're determined by science and the public interest. And that's what guides me, and that's what guided me in that first term when I served. And when President Biden asked me to come back and serve as Surgeon General a second time, that's what's guided me here too.